We've all had it drilled into us our entire lives. The key to staying healthy is to catch it early. But what if that's not the whole story? What if, especially as we get older, some of the most common health tests are actually doing more harm than good? That's the surprising and frankly vital topic we're going to dig into.
I know, it sounds totally backwards, right? More tests, more information, that has to be better, doesn't it? Well, the latest science is starting to tell a very different story, especially for those of us over 70. A routine scan could send you down a rabbit hole for a harmless spot, ending in a risky biopsy. Or a screening test could put you on the path to a major surgery you never even needed. So we really have to ask ourselves, is all this testing actually making us healthier?
And look, this isn't just a hunch. The evidence is piling up. A really important study found a shocking number. For people over 70, up to 37% of medical tests kick off a whole cascade of interventions, treatments, complications, side effects that were just completely unnecessary. That is more than 1 in every 3 people. It's huge.
And this all leads us to what experts are now calling the screening paradox. It's this fundamental clash between the idea we've all grown up with, early detection is everything, and the hard data that shows for older adults that exact approach can seriously backfire.
It's such a powerful idea, isn't it? Find it early, fix it early. And hey, for a 50-year-old, that logic is often spot on. But once you're past 70 or 75, your body is playing by a different set of rules. The whole equation of risk versus benefit just gets turned on its head.
This image of the scales is just a perfect way to think about it. When you're younger, the benefit side of the scale is weighed way down. It's a no-brainer. But as you get older, the other side starts getting loaded up with the harms. The risks from the test itself, the anxiety, the follow-up procedures, and pretty soon, that scale can tip in the wrong direction.
Now, a huge piece of this problem is a concept with a fancy name, overdiagnosis. But it's a simple and kind of scary idea. It's when a test finds something, usually a super slow-growing cancer, that was never, ever going to cause you a single problem in your lifetime. But now it's been found. And, just like that, you're on a path toward treatments you never needed in the first place.
So how does this actually happen? I mean, in the real world. Let's get specific and look at 3 really common medical tests to see this paradox in action. All right, let's start with a big one, the colonoscopy. And let's be absolutely clear, this test has saved countless lives. But for the average person without specific risk factors, the leading panel of experts in the US recommends stopping routine screening at age 75. And there are some darn good reasons for that. You can see the changing math perfectly right here. For someone who's 55, finding and removing a polyp is a clear win. But for a 75-year-old, the risks from the procedure itself, the really harsh prep, the sedation, the small but very real risk of a perforated bowel, those risks start getting a lot bigger, while the potential benefit gets smaller.
And if you want the cold, hard data, here it is. This was a huge study of over 1 million Medicare patients, and it put things in really stark terms. For those over 75, the ratio of serious harm to lives saved was a staggering 10 to 1. That's a gamble a lot of us are taking without ever knowing the odds.
Okay, let's move on to another really common test, one that has become incredibly controversial for older men, the PSA blood test for prostate cancer. The trouble with the PSA test is it creates this perfect storm of overdiagnosis and overtreatment. A slightly elevated number on a blood test triggers an invasive biopsy. That biopsy then often finds a slow-growing cancer that was never a threat, which then leads to treatments like surgery or radiation that can have absolutely devastating, life-altering side effects. In so many cases, the cure is far, far worse than the disease.
And finally, let's talk about the rise of the full-body CT scan. The one that's often marketed as this sort of premium, executive health product. Well, leading medical experts are starting to sound a major alarm. So here's a number that should really make you stop and think. Recent studies suggest that the radiation from unnecessary CT scans might not be responsible for up to 5% of all cancers in the US. To put that in perspective, that's a cancer risk right up there with being a daily drinker. The scan itself can become the thing that causes cancer.
But the real danger is what doctors called the cascade of care. The scan finds a tiny, harmless little nodule, just a normal part of aging. But now it's in the report. This triggers anxiety, which leads to more scans and maybe even a risky needle biopsy. You get this whole snowball of fear and procedures, all for something that was never, ever going to be a problem.
Okay, so if the old playbook of screen for everything is flawed, what's the new framework? How should we be thinking about our health and longevity in our later years?
Well, it starts with a simple but really profound idea called competing risks. It's just the statistical reality that once you're in your late 70s or 80s, you are far, far more likely to be affected by something like heart disease or a stroke, long before a slow-growing cancer that was found on a screening test would ever become an issue.
And this right here just illustrates that point perfectly. Just look at the actual causes of death for women in this age group. Heart disease is the cause for 240 of them, while breast cancer is the cause for only 20. That means heart disease is 12 times more likely to be the cause of death. It really puts the focus of all this screening into a totally different perspective.
So what do the official guidelines say? Well, the U.S. Preventive Services Task Force, they're the gold standard for this kind of advice. They have some pretty clear recommendations. This table basically lays out the ages where, for most people, the harms of routine screening really start to outweigh any of the benefits.
But look, at the end of the day, this isn't about rigid rules. It's about empowering you with the right information so you can make the best choices for your own health in partnership with your doctor.
So, how do you have this conversation? Here are 4 incredibly powerful questions you can ask. They help shift the focus from just finding things to making sure that whatever you decide to do will genuinely improve your life.
And I think this quote just captures the shift in thinking we need perfectly. The goal of medicine, especially as we get older, isn't just about adding more years to your life. It's about protecting the quality of that life. It's about more good days, not just more days.
And that brings us to the most important question of all, and it's one that only you can answer. What does being healthy truly mean to you? Is it about getting a perfect score on a test? Or is it having the strength and the energy to enjoy your life, your family, and your passions? It's a question worth asking, and it's a conversation definitely worth having.